Welcome to Integrated Health of Indiana's CBC CMP blood work talk. And today, the component we're going to talk about is hemoglobin A1c. And so, as we start to dig into this, hemoglobin A1c has traditionally been used as a metric for diabetes. And as we look at this, normal A1c is less than 5.7. And then there's a misprint right there. That 7 or that 6 should be a 7. That's the diabetic range. Pre-diabetes is that 6 range. Optimal is actually less than 5. But all in all, hemoglobin A1c is a horrible metric for diabetes. But what is it good for? So if you think about what hemoglobin A1c does in the body, it measures the amount of hemoglobin that is stuck to the red blood cell. And so you start to get an idea of what blood sugar has been over a long period. So they call it an estimated average daily glucose. The assumption that they work on is that these blood cells are lasting 3 months. And we know that that's actually incorrect. There are several things that cause that to be different or to affect the life of a red blood cell. So, what is wrong with the assumption? If we start to look at it, if you have an endurance athlete, like I did Ironman and endurance athletics, oh goodness, what else? All kinds of triathlons, the things where you go out into the field, orientation, adventure racing, that type of stuff. Basically, endurance athletes, their red blood cells last longer and thereby artificially raising A1c. Also, if a patient is iron deficient or anemic, well, then what happens to them, or if they've had their spleen removed, A1c will be higher as well. If that patient has kidney disease or an enlarged spleen or sickle cell anemia, their red blood cells have a shorter life, and so it'll be artificially lower. So, what is hemoglobin A1c good for? And that's what I was talking about a little bit earlier. It's good to get a measure of your average daily glucose because when we can take what somebody's A1c is, we can put it into an equation and then we can start to tell what somebody's average daily glucose is. And the lower that average daily glucose is, the better it is. So, what are better metrics for diabetes now? Well, if you run an oral glucose tolerance test and then you measure serial insulin, so you take insulin before the glucose solution is administered, then you take it at 30 minutes, you take it at an hour, you take it at 2 hours, then you start to get an idea of what insulin is doing and how it's behaving. And that is a lot more important. So if you want to see our other presentation on insulin, we go a little more in depth in that. But for right now, this seems to be a pretty good overall what is hemoglobin A1c, and it gives you an idea that it's really not a good metric anymore. It's kind of an old, outdated metric, but you can get estimated average glucose off of it, daily glucose off of it. Have a great one, and we'll see you on the next one.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.